Your dog's breath shouldn't smell like something died in there. If it does, if you've noticed a yellow-brown crust building along the gum line, or your dog pulling away when you touch their mouth, I need you to keep watching, because what I'm about to show you takes less than 60 seconds a day, costs almost nothing, and most dog owners have never heard of it. I'm Dr. Waterling Lee. I've spent years in small animal practice, hands in more dogs' and cats' mouths than I can count, and if there's one thing that gets underestimated more than anything else in pet care, it's dental disease. Not ear infections, not fleas, dental disease. By the time most dogs turn 3, the majority already have some degree of it, and it's quietly doing more damage than owners realize. So today, I want to walk you through something simple. What actually causes that hard tartar buildup, why brushing alone often isn't enough, and one thing you can add to your dog's water bowl that can genuinely help slow it down. Stick with me to the end, because I'm also going to tell you the one thing I see owners get wrong that undoes all of this, and it's more common than you'd think. Let's start with what's actually happening in your dog's mouth. Every dog has bacteria living on their teeth. That's normal, every mammal does. Within hours of eating, a thin, invisible film called plaque starts forming on the tooth surface. If it's removed regularly, no problem. But if it isn't, minerals in the saliva start to harden that plaque into something much tougher, tartar, also called calculus. And once tartar forms, it's not coming off with a toothbrush anymore. At that point, it's practically cemented onto the tooth. Here's the part most owners don't think about. Tartar isn't just cosmetic. It's not just a yellow stain that makes kisses less pleasant. As it builds up along the gum line, it creates a rough surface that traps even more bacteria, which pushes down under the gum tissue. That leads to gum inflammation, what we call gingivitis. And if that's left unaddressed, it can progress into periodontal disease, which affects the structures actually holding the tooth in place. In advanced cases, dogs lose teeth. In more serious cases, that chronic bacterial exposure has been linked to stress on the kidneys, liver, and heart over time, because that bacteria doesn't always stay in the mouth. It can enter the bloodstream. So this isn't just about fresh breath. This is about your dog's whole body health, and it's happening slowly, quietly, mouth by mouth, meal by meal. And most owners don't catch it until a vet points a light in there and says the word extraction. Now, I know what a lot of you are already doing, and I want to give you credit for it. You're brushing. Good. Brushing is genuinely one of the best things you can do. But here's the honest truth I tell my own clients. Most dogs don't get brushed daily. Life gets busy, dogs squirm, and even in dogs who do get brushed regularly, brushing mainly cleans the outer tooth surfaces. It often misses the back molars, the inner surfaces, and definitely can't touch what's already hardened into tartar. That's where a water additive comes in, and I want to be precise about what it can and can't do, because I don't like overselling anything to pet owners. You deserve the truth, not a miracle claim. A quality dental water additive works primarily on the plaque stage, the soft, early buildup, before it has a chance to mineralize into hard tartar. Many of these products contain enzymes or mild antibacterial compounds that reduce the bacterial load in the mouth every time your dog drinks. Since dogs drink water multiple times a day, every single day, you're getting a level of consistency that brushing alone almost never achieves. Think of it less as a magic eraser for tartar that's already rock hard, and more as a way to stop the next layer from ever forming in the first place, while also helping loosen some of the softer buildup already sitting at the gum line. That distinction matters. If your dog already has heavy tartar, a water additive is not going to dissolve it away overnight. And if anyone tells you that, be skeptical. What it will do, used consistently, is slow the progression, freshen the breath noticeably within days, and support the gum tissue so it's less inflamed and less likely to bleed. So here's what I actually recommend to my clients, step by step. First, choose a product designed specifically for pets. Never use a human mouthwash or human dental rinse in a dog's water. Many contain xylitol or alcohol, and xylitol in particular is highly toxic to dogs, even in small amounts. This is one of the most important safety points in this entire video, so I want to say it clearly. Check the label, and if you're ever unsure, ask your vet before adding anything to your dog's water. Second, Look for additives with enzymatic action, ingredients that specifically target the biofilm bacteria live in, not just something that masks odor. Odor-masking products smell nice for an hour and do nothing for the actual disease process underneath. Third, introduce it gradually. Some dogs are sensitive to a sudden change in the taste of their water, and the worst outcome here is a dog who decides to stop drinking water altogether because it tastes different. Start with a diluted amount, let them get used to it over several days, and always make sure fresh plain water is available as a backup if they refuse. Fourth, and this is the step almost everyone skips, pair it with mechanical cleaning whenever you can. Even 2 or 3 brushings a week, combined with daily water additive use, does more than either one alone. Dental chews formulated with the Voch seal of acceptance can help too, because the physical scraping action works differently than a liquid additive and covers the gap the additive can't. Now let me give you the mistake I mentioned at the start, the one that undoes almost everything I just told you. Owners start strong. Week 1, they're consistent, measuring it out, watching their dog's breath improve, feeling good about it. Then week 3 hits, life gets busy, and the additive quietly disappears from the routine. Dental disease doesn't come back overnight when that happens. It creeps back in slowly, which is exactly why people don't notice until months later when the tartar's returned and the breath is back to where it started. Consistency is the entire mechanism here. This isn't a one-time treatment. It's a daily habit. The same way brushing your own teeth only works because you do it every day, not once a month. I also want to address something I hear constantly in the clinic. But my dog's breath smells fine, so I don't think they need this. Please don't wait for bad breath as your warning sign. By the time the smell is noticeable to you, there's already meaningful bacterial activity happening. The earlier you start supporting your dog's oral health, ideally well before any visible tartar, the more you're preventing rather than managing. And one more thing, because I care about giving you the complete picture, not just the encouraging part. A water additive is a support tool, not a replacement for professional dental cleanings. If your dog already has significant tartar buildup, gum recession, or bad breath that isn't improving, please have your vet do a proper oral exam. Sometimes what looks like routine tartar is actually a deeper issue. A fractured tooth, an abscess, resorptive lesions in cats, things only a hands-on exam and, when needed, dental x-rays under anesthesia can catch. I never want a home routine to replace that professional check-in. Use it alongside your vet's guidance, not instead of it. If you've made it this far, I want you to do one simple thing today. Go look at your dog's back teeth, gently lift the lip, and just take a look. Are the gums pink and calm, or red and puffy? Is there a yellow-brown crust along the gum line? That 30-second check tells you more than most owners realize, and it's the first step to actually doing something about it, instead of waiting until it becomes a bigger problem. Your dog trusts you completely with their care. They can't tell you when their mouth hurts, they can't ask for help, and they will absolutely hide pain far longer than you'd expect. It's an instinct left over from their wild ancestors. That's exactly why this kind of quiet, consistent care matters so much. A few seconds a day, added to their water bowl, is such a small ask for the difference it can make in how they eat, how they feel, and honestly, how many years of healthy, comfortable life you get to share with them. If this video helped you understand your dog's dental health a little better, do me a favor and hit like. It genuinely helps this information reach more pet owners who need it. Subscribe if you want more straightforward, no-nonsense veterinary guidance like this. And drop a comment below telling me your dog's name and how their breath is doing right now. I read every single one, and I love seeing who's out there taking this seriously. Taking care of your dog's teeth isn't glamorous. Nobody posts about it. But it's one of the most quietly powerful things you can do for their long-term health, and now you know exactly how to start. Give your dog a scratch behind the ears for me. Take a look at those teeth today, and I'll see you in the next one.